Okay, so I have both PowerPoints up. I forgot to send y'all the last one, so I'll try to remember to send y'all this one. We've gone through majority of the upper GI system, the mouth and the accessory glands and the amylase, which starts to break up carbs in your mouth, the ducts and the glands that are in your mouth. And what they secrete, and if you remember which ones get inflamed for mumps, make sure you know that. And then how the epiglottis covers the trachea so that the food and drink can be guided down the esophagus, which lies behind the trachea. It passes the upper esophageal sphincter into the esophagus. At that point, it becomes involuntary. The esophagus starts to push the food down to the lower esophageal sphincter into the stomach. Now, at the stomach, there are different types of cells in the stomach that secrete different things. You know, you've got the mucus that produces mucus in the stomach to help keep it moist. And you've got different cells in there that help break down some of the food. Hydrochloric acid, I believe, to help the acidity to break down that food. So remember, it drops from the esophagus. The stomach is to the left. It drops in here. It churns it up with that acid and it becomes chyme or chyme, however you want to pronounce that, where it is pushed this way. Once it's pushed this way, it has to go through the pyloric sphincter in order to drop into the small intestine. The small intestine has 3 different parts, which I believe is your duodenum, your jejunum, and then your ileum is towards the bottom, at which point it goes into the large intestine. I'm going to go ahead and show you this real quick until we get to where we need to get to. We did talk about the... Oh, you know what? I was going to mention my little hernia on here, but I'm going to leave it alone. We'll talk about it tomorrow. So, GERD, Barrett syndrome, you've got reflux because the lower esophageal sphincter isn't working very good anymore. Then you've got the hernia, where another organ pops into a cavity where it's not supposed to be, or out of pocket, out of a place it's supposed to be, where it's supposed to be tight and secure. Okay, so I'm sorry, we came over here, we talked about, and we got to the small intestine, I think. Well, we'll start there. Okay. So coming over here, it shows again, you start at the mouth, you got salivary glands, it passes the pharynx, the epiglottis covers the trachea so that we can go down the esophagus, upper esophagus, lower esophageal, to the stomach, to the pyloric sphincter, into the small intestine. Okay, you've got your 4 layers again, and then you've got your muscularis. This is usually what does the work in the different places that you find the muscle. Muscles contract and they relax. I need you to understand that concept. No matter where muscle is located, muscle is to contract and relax. So you've got your mucosa, submucosa, your muscularis, your serosa, different blood vessels to provide oxygen and nutrients. Enteric nervous system, which is this is what's going to tell it, okay, we got food here, go ahead and start mashing up, go ahead and start moving forward. You don't need to know that. So, no, I don't think it's in yours either. I don't want you to know it if you don't need to. Okay, same, starting with the mouth, you got your uvula, you've got your soft palate. Remember, your soft palate starts down here. So your soft palate, the uvula is part of your soft palate, and it's in the back, and it comes down, and it's kind of an extension of underneath the tongue. You've got all your glands, sublingual gland under your tongue. You've got ducts because they secrete their secretion into the ducts in order to get it into the body or where they need to. Submandibular, parotid, and then the parotid duct. And secretion will drop from up there. Got your teeth. Again, enamel, gum, gingivitis, your periodontal, where is it? Yeah, the periodontal right here, the ligament that's holding the tooth in place and things in place, that can become inflamed as well. Periodontitis, I believe, which is a more serious complication of gingivitis. Your pharynx, which is your throat. Remember, the pharynx breaks down into your nasopharynx, oropharynx, laryngopharynx. Food is broken down, moistened, and moved to the back of the throat. Soft palate lifts. Soft palate lifts. Larynx rises. Food moves toward the esophagus. And that's the food right there. We start to swallow, and we're swallowing. Okay, we swallowed. This is your stomach. Okay, the different parts. Your pyloric sphincter. Pylorus. So this would be the part that has the spasms, right? We were talking about earlier. Okay, same thing. I think y'all got that picture in your book. So, again, here you have the different cells, right? You have mucus cells which secrete mucus. Your parietal cells which secrete hydrochloric acid. I think I might have said chief. Secrete hydrochloric acid and intrinsic factor. Intrinsic factor is what we need to absorb B12. Chief cells secrete digestive enzymes, and your enteroendocrine cells secrete ghrelin and gastrin. This tells you if you're hungry or not hungry. So again, chyme, right? We swallow the food. It empties into our stomach. That's the lower esophageal sphincter. Contraction breaks down food and mix it with gastric juices to form chyme or chyme. Chyme moves toward pyloric sphincter. About 30 ml squirts into the duodenum. Stomach continues to mix contents and gradually releases chyme into the duodenum. Your phases of digestion. You've got cephalic phase, which is your sight, smell, taste, thought of food when you're hungry, right? Stomach will start to secrete gastric juice and gastrin. Your gastric phase, food enters the stomach, secretion of gastric juice and gastrin increases to help break down that food and create chyme. Intestinal phase, chyme enters your duodenum and gastric secretion inhibited. Means it stops. So you've got your liver located over here on the right upper quadrant, majority. Okay, you got your hepatic artery, your portal vein. You've got common hepatic duct right here. You've got your gallbladder right here. So you see it secretes its secretions here. Okay. Okay, so same thing, gallbladder is right here. It's going to secrete its secretions, cystic duct, common bile duct, right and left hepatic ducts. So hepatic is your liver. So see, the liver is dropping its stuff in here. The gallbladder is dropping its stuff in here, and this becomes common bile duct. And then it empties right here into the pancreas, some of it, right? And this is the small intestine. So it comes here into the pancreas where it empties into, mixes whatever is in the pancreas. What the pancreas is secreting into the small intestine. Well, you know what? We didn't go over that, did we? This is going over this first. So we're just going to go through this real quick, y'all. Small intestine. There we go. Perfect timing. Okay, small intestine again. You got the duodenum that's connected to your stomach by the pyloric sphincter. It empties into the small intestine, site of most digestive processes, meaning the most where it's breaking it down. really chemically breaking it down. Remember, our mouth is mechanically breaking it down. Things are moving mechanically, but then to break it down. But then chemically, it's the enzymes that's breaking it down to the smallest it can get to so that we can absorb it. So from the duodenum, it moves into the jejunum. This is where most of your absorption happens. So remember we talked about absorption and microvilli. Microvilli are extensions of that tissue. Most likely you're going to find it everywhere, but most likely you're going to find it real good in here because that's the site of where your nutrient absorption happens. Granted, it happens in other places, but I'm assuming if it happens more in here, that's probably where you're going to find more microvilli. Your ileum is site of your Peyer's patches. That is protection is part of your lymphatic system. But our gut is unclean. That's why, the bathroom and the gas and stuff, it's unclean. Nothing in there is sterile. And so to have Peyer's patches, to have your lymphatic system in here trying to keep you safe, keep E. coli out the way, keep bacteria, viruses, and things, parasites, clean in your gut. Okay. We were talking about this earlier with the segmentation and peristalsis. What I really need you to know is the peristalsis. Peristalsis is this, where the wave-like movement, wave-like ripples move digested material along your GI tract. This is what keeps it moving forward. But as it squeezes and moves forward, it's kind of, let me say this. It's segmenting, right? Even though it's pushing forward, it's still in these little cracks right here. You notice it's breaking food down as it passes. And then in here, it's kind of moving it. And then it's breaking it more down as it gets into the itty bitty spaces that's coming in together. And then it gets segmented and it's kind of shaking a little bit here as it's moving forward. But it's constantly moving forward. And that's where that shaking Miss Sylvia that you read that goes back and forth is because it's literally like a wave. So yeah, it's kind of shaking it, but it's moving it forward. Okay, so it's taking the food and it's moving it forward in wave-like. So that's that segmentation. Ring-like contractions break food and mix it with digestive juices. All right, intestinal lining, same 4 circular folds. Here you've got your villi, your microvilli. We just talked about that. It increases surface area so that it can absorb more there's more space for nutrients to be absorbed. Chemical digestion and absorption uses digestive enzymes, transforms food molecules into particles that can be absorbed, occurs mostly in the small intestine, and process varies between nutrients. Let me go over here. Small intestine lining is your mucous membrane. Many microscopic glands, intestinal glands, secrete intestinal juice. You've got microvilli that contain blood and, let me read that. Circular folds are covered in villi that contain blood and lymph capillaries. Your 3 sections are your duodenum, jejunum, and ileum. Okay, I think y'all have that picture in your book. It's kind of one of the ones over here I was showing you. Okay, disorders. Let me make sure. Carbohydrate digestion. Okay, so real quick with the mouth, carbohydrate digestion begins in the mouth with amylase. We said that earlier. Continues in the small intestine with pancreatic amylase. So you need to connect amylase with carbs. Finishes at your microvilli with sucrase, lactase, and maltase. So this is what's formed after the amylase breaks these carbs down. Your protein, you know what? Let's get over here real quick. I'm sorry, y'all. We'll come back to this. Disorders, because I believe we have, this is over here as well, but at the end. Enteritis, itis, inflammation, intestinal inflammation, gastroenteritis, inflammation of your stomach and intestines. I think we did do this. Malabsorption syndrome, group of symptoms resulting from failure to absorb nutrients properly, meaning you are anorexic, I'm sorry, anorexia, weight loss, abdominal bloating, cramps, anemia, and fatigue. These are signs and symptoms. Maldigestion is just deficit of digestive enzymes or bile salts, reduces amount of nutrients for absorption. So if I don't have those enzymes, it can't break down the food and it can't be absorbed. Liver. The liver is the largest gland. It fills the upper right section, so your right upper quadrant is classified as an exocrine gland because it does have ducts. It secretes its material into a duct in order to get it to the body, and that is an exocrine gland. Secretes bile, has a variety of metabolic functions. Y'all need to look that up if y'all don't know what that means, because we've been talking about that all semester. It is just the breakdown of things. The breakdown to use of energy. We use when metabolic functions are happening, it is to use everything for energy, to break it down and use it for energy, convert it to energy. Liver contains ducts. Your hepatic, which drains bile from the liver. Your cystic duct, by which bile enters and leaves your gallbladder. Common bile, formed by union of hepatic and cystic ducts and drains bile from, that was the picture we looked at earlier, y'all. Your gallbladder is undersurface of the liver. The function is concentrates and stores bile produced in the liver. We kind of looked at these pictures on this other slide as well. You'll see this common hepatic duct, your common bile duct. Okay, again, common bile duct because it comes here and then it joins right here from the pancreas, and they empty their substance right here in the duodenum. Gallstones are stones made of crystallized biopigments and calcium salts. Cholelithiasis, condition of having gallstones. Cholecystitis is inflammation of the gallbladder. You may get inflammation of the gallbladder due to having these stones. Stones can obstruct bile canals, causing jaundice. The liver breaks down. No, you know what? Let me not say that. Okay, gallstones, hepatitis, inflammation of your liver. Liver inflammation characterized by liver enlargement, jaundice, anorexia, discomfort, gray-white feces, and dark urine. Caused by a variety of factors: toxins, bacteria, viruses, hepatitis A, B, and C, and parasites. Just what it says, inflammation of the liver. If it is inflamed, if it is injured in any kind of way, is not going to work properly. The liver does a lot of things. It stores energy. It gives bile to your gut. It breaks down red blood cells. It filters. And so if our liver is not working properly, it's not going to do any of that stuff, which is going to cause a lot of other signs and symptoms. If you notice, the jaundice has to do with our skin, but the breakdown of red blood cells, we start to lose weight and we don't want to eat. We have gray white feces and dark urine. It's affecting our GI, our GU, our skin, our blood. Cirrhosis and portal hypertension, degeneration of liver tissue. So our tissue is actually degenerating. It's dying off, involving replacement of normal but damaged tissue with fibrous and fatty tissue. So fibrous tissue and fatty tissue, if it's not proper hepatic cells, is not going to work properly again. It's supposed to be smooth. Portal hypertension, high blood pressure in the hepatic portal veins, caused by obstruction of blood flow in a diseased liver, may cause varicosities of surrounding systemic veins. So we've heard of varicosities, right? Varicose veins. Varicose veins, meaning weak valves, meaning twisted and thinned out veins. And again, those are not going to work properly. So if the veins in the liver, where there's a large blood supply and where it does a lot of the filtering for blood and stuff like that, and moving of blood, for our veins not to work properly is going to cause a lot of issues. Your pancreas is behind the stomach. Your pancreatic cells secrete pancreatic juice into your pancreatic ducts. Your main duct empties into your duodenum. Your pancreatic islets or islets of Langerhans, cells not connected with pancreatic ducts, they secrete hormone, glucagon, and insulin into the blood. So you see, your pancreas is an endocrine system. Is an endocrine gland, because part of it, these cells in the pancreas actually secrete glucagon and insulin. And remember, this is your homeostasis for sugar. Glucagon will put sugar when our sugar is low, and insulin will hopefully take sugar out when our sugar is high. But here it functions in the GI system. Pancreatitis, just what it says, inflammation of the pancreas. Acute pancreatitis results in blocked ducts that force pancreatic juice to backflow. These pancreatic enzymes digest the gland. They start to eat away at the gland because they're not supposed to be there. But that's what enzymes do. They break down things. And so that duct has to be working so everything can flow through and not back up. Cystic fibrosis, thick secretions block flow of pancreatic juice. Pancreatic cancer, cystic fibrosis. A lot of times they're going to notice this when you're a child. It's not just a pancreas, it is thick secretions. Whatever makes secretions in your body is going to, majority of it is going to make it real thick, and it's going to block ducts. So things are going to back up. It's going to thicken in the lungs. So they're just going to keep trying to cough up secretion, putting them at risk for aspiration on their own secretions, and pneumonia, and that pneumonia turning into bacterial or viral because they can't cough it up and clear their airway. But the same in their pancreas. If that backs up again, if the thick secretions start to block the flow and they back up, you're going to have a lot of signs and symptoms, other issues. Pancreatic cancer is very serious, fatal in the majority of cases. Okay, my large intestine. I don't think we went to large intestine here, did we? Okay. You got the divisions, just like you have three, the duodenum, the jejunum, and the ileum in the small. You have your cecum, your colon. Your colon further breaks down into ascending, which is going up, transverse, and descending. Then you've got the sigmoid right here, and then you've got the anal canal, and then you've got the anus. Now, right here, okay, the small intestine would be, and you would have, if you look on the slide or in your book, it says right here, the ileum. So the ileum is the last part of the small intestine, and it empties of food right here into the large intestine. Okay, that's why it then goes ascending, transverse, and descending. Disorders of your large intestine. I wonder if y'all can see that during recording. Diarrhea results from abnormally increased intestinal motility, may result in dehydration or convulsion. So our body's not really absorbing any of the nutrients. It's just literally going straight through you. Nothing's being broken down. Well, it's being broken down real quick, but it's not being absorbed. And so you're not absorbing water, electrolytes, or nutrients. And that can dehydrate you. And so you're not going to have any electrolytes, any water. Constipation results from decreased intestinal motility. You don't have enough water. Diverticulitis is inflammation of abnormal outpouchings called diverticula, may cause constipation. Colitis, general name for any inflammatory condition of the large intestine. Colorectal cancer, common malignancy of the colon and rectum. I need y'all to read that, okay? Your appendix and appendicitis. Vermiform appendix is blind tube attached directly to the cecum. They say no important digestive function in humans, but I don't know that I believe that. Is that it? We don't talk about it here. Because I read somewhere else that they're starting to show that your appendicitis does matter. I'm sorry, appendix. Your appendix, not appendicitis. Your appendix does matter, and it does play a part. But I thought it was here, but I guess not. I need to find it. No important digestive function in humans. Appendicitis, inflammation, or infection of the appendix. If appendix ruptures, infectious material may spread to other organs. Most common acute abdominal condition requiring surgery. This is life-threatening within a couple of hours. Literally, you'll bleed out. Peritoneum description, large, and it is located in the right, I believe. Right lower quadrant. So anytime anyone comes in and says they got real bad pain in the lower right lower quadrant, that's what I'm saying. As a nurse, your head should start going. If they say, well, my right lower quadrant, it's been hurting for a few hours, I'm in severe pain, your mind should start thinking possibly appendicitis. Peritoneum description, large sheet of serous membrane, parietal layer of peritoneum lines abdominal cavity. Visceral layer touches the actual organs. Peritoneal space, there's always a space in between layers. That's what that picture over there was trying to show. Largest of the mesentery and greater omentum. Mesentery, extension of your parietal peritoneum, which attaches most of small intestine to posterior abdominal wall. Let me get it here, y'all. So, our organs are sitting here, right? We got all them intestines right here, and they take up a good amount. But, gravity would drag them all down. And if gravity dragged them all down, everything would be sitting on top of our bladder. And for us women, they'd be sitting on top of our uterus, right? So it kind of has to be our whole gut, right? Our stomach, our intestines, all kind of have to be anchored. If you're from California, you know what I mean, or anywhere where there's earthquakes. We anchor all the dressers to the wall, the TVs to the wall, so that when there's an earthquake, they don't fall forward. That's kind of what this does, the peritoneum. The peritoneum lines the cavity, but it's also attached to the organs because it's kind of anchoring it to the wall, so gravity doesn't pull everything down. Mesentery extension of parietal peritoneum, which attaches most of the small intestine to the posterior abdominal wall. Your greater omentum hangs down from the lower edge of the stomach and transverse colon over the intestines. Peritonitis, inflammation of peritoneum resulting from infection or other irritant, often a complication of a ruptured appendix. Ascites is abnormal accumulation of fluid in your peritoneal space, often causes bloating of the abdomen. So that fluid is going to go all in between the spaces of our organs. Okay, and it's going to look like they're pregnant, just like that. I had a person at clinical. I don't know if they had just had surgery or what, but he was standing up, and all of a sudden this down here burst, and all his fluid came out. It was all over the floor, like his water broke. Okay, digestion, process that transforms food into a form that can be absorbed and used by cells. So again, digestion, it begins in the mouth. Mechanically, we're breaking it down. Mechanical digestion is your chewing, your swallowing, and peristalsis will break down the food into tiny particles. They'll mix them well with digestive juices and move them along the digestive tract. So mechanically, we're chewing, that's mechanical breakdown. That is mechanical digestion. Swallowing down and as it kind of smashes through the esophagus, it's also mechanical breakdown because it is using our organs to break the food down into smaller pieces, okay? Peristalsis, as it moves, is breaking it down. We saw how it was breaking it down. Now, that is breaking down the food mechanically into smaller pieces. Chemical digestion happens when, breaks up large food molecules into compounds. So, let me not say that. Mechanically, it breaks it down into smaller foods so that our chemicals can then kick in and start to digest that food chemically. Mechanical can only go so far. Chemicals have to go in and really dissolve and pull those atoms, those chemicals apart. It'll break up into large food molecules, into compounds having smaller molecules, because molecules break down into atoms, right? Elements and atoms brought about by digestive enzymes. Enzymes are protein molecules. Everything starts as a protein. Protein molecules that act as catalysts. Speeding up chemical reactions, chemical digestion. Specific enzymes need speed up breakdown of specific molecules and no others. Enzymes, protein molecules that act as catalysts, so they break down, speeding up chemical reactions. Chemical digestion, specific enzymes that speed up breakdown of specific molecules. Hydrolysis, enzymes speed up reactions that add water to break large molecules into smaller molecules. All right. Occurs mainly in the small intestine. Pancreatic amylase. Amylase begins with amylase. Changes starches into maltose. Intestinal juice enzymes. Your maltase changes maltose into glucose. Your sucrase changes sucrose into glucose. Sugars. Carbohydrates is sugar. Okay. So even when you think you're not eating fat, but you're going to eat these carbs, it breaks it down into sugars, glucose. Pancreatic amylase finishes at the villi with sucrase, lactase, and maltase. Protein digestion begins in the stomach with pepsin. I need y'all to know this. Continues in the duodenum with trypsin and chymotrypsin. Finishes in the small intestine with peptidases. Peptidases, ACEs, that's going to be your enzyme. Starts in the stomach, completed in the small intestine. Gastric juice enzyme pepsin partially digests proteins. Pancreatic enzyme trypsin completes digestion of proteins to amino acids. Amino acids make proteins. Proteins break down into amino acids. Intestinal enzymes, peptidases, complete digestion of partially digested proteins to amino acids. We're going to really use those amino acids in our DNA and stuff. Okay, fat digestion first requires emulsification. Continues with pancreatic lipase, lipids, fat. Some fats absorbed into the bloodstream of the villi. Other fats changed into triglycerides and into the lymphatic system. Bile contains no enzymes but emulsifies, meaning it really mashes it down. Fats breaks fat droplets into very small droplets. Pancreatic lipase, again, lipase, lipids, fat, changes emulsified fats to fatty acids and glycerol in small intestine. All right, absorption. Definition is digested foods move from the intestine into blood or lymph. When we finally break it down mechanically, when we finally break it down chemically, after the lipase, after the amylase, after all those pepsin and laces and everything, right? We absorb it. Once we absorb it, digestive food, that will move into our blood or into our lymph for removal. That's how we reabsorb all those nutrients into our blood, and then our blood uses it. But you see, most everything breaks down into sugar or amino acids. Absorption site. Nutrients and most water are absorbed from small intestine. Some water are also absorbed from the large intestine. That's all I need you to know.